Hello, everyone. Today we are going to talk about breast cancer awareness because we all know October is the month of breast cancer awareness. This is to enjoy our journey to wellness. The main purpose of this presentation is to educate the general public and empower them with the knowledge so they can inspire others and get inspired themselves. My name is Vishnumaya Upadhaya. I'm a triple certified family, women, and mental health nurse practitioner. Who develops breast cancer? The fact that I like to share, 1 in 8 women that we meet today have average risk of getting breast cancer in their lifetime. 1 in 8. Breast cancer stats and facts that I like to share today. There are about 276,000 new cases of invasive breast cancer. So we know that it exists out there. 48,000 new cases of new non-invasive breast cancers will be diagnosed in 2020. And about 42,000 of women in the US are expected to die from breast cancer. So you know that this cancer exists and we can prevent that from getting out of control by bringing the breast cancer awareness. We know early detection brings the best outcome and good survival. Breast cancer is not only found in women, it's also found in men. If you look at it, a man's lifetime risk of breast cancer is about 1 in 883. So the men who are out listening to this, please pay attention and do take the facts in consideration that you could be exposed to breast cancer. And there are about 2,600 new cases of invasive breast cancer found in men in 2020. Breast cancer fact with the good news, there are about 3.5 million breast cancer survivors in the US. So this means the cancer exists. If we start detecting, taking therapeutic approach, it can be cured and we can increase the survival rate higher than 3.5 million. So the key is early detection and advanced treatment. The question that's being asked by women, why am I at risk for breast cancer? Very simple. Prolonged exposure to estrogen, one of the female hormone, puts you at a higher risk. Also, early ages of starting your menstrual cycle. Girls who started their cycle before age 12, women who had their cycle beyond the age of 55, or if you never had babies, or if you had your first child after the age of 30, or you never breastfed. These are the factors that put you at a higher risk for breast cancer. So you need to ask yourself, am I at a higher risk? If you do, please bring it to the attention of your healthcare provider so they can examine you and monitor you closely. Being women, just being women puts you at a higher risk. So that's how you need to go for your self-breast exam, clinical breast exam, your annual exam, your mammogram, and thereafter follow the advice of your healthcare provider. 75% of women diagnosed with breast cancer are found beyond age 50, after the age of 50. So if you are women after the age of 50, please pay attention and look for those clues that put you or that could push you at a breast cancer high risk category. There are some non-modifiable risk factors, 5 to 10% due to changes in genes, put you at a higher risk. If you have BRCA1 and BRCA2 mutation, that puts you at a higher risk as well. BRCA1 and BRCA2 gene mutations are more often found in Jewish population. So if you are from Jewish population, please bring it to the attention of your healthcare provider. Having a first degree relative, your mother, your sister, your daughter, puts you at double risk of getting breast cancer. But the risk gets tripled up if you have 2 first degree relatives who had breast cancer. So please give your history to your healthcare provider very carefully so they can find out what risk category you fall into. If you're physically inactive, you're going to gain weight. With that comes higher estrogen, and you know that higher exposure to estrogen for a long time puts you at a higher risk for breast cancer. Like we mentioned, if you never had children, or if you have your first child after the age 30, but you never breastfed, ask yourself these questions. If you do, please seek the advice of a healthcare provider to find out what are your individual risks of breast cancer. Not eating healthy food also puts you at high risk. So my advice for you, change your lifestyle, diet, exercise, good sleep, eating diet that is very close to Mediterranean diet, which is lots of fiber, fruits, veggies, clean fat, oil like avocados, olive oil, decreases your risk factor for having breast cancer. Drinking also puts you at a higher risk. It says that one drink per day increases by 7 to 10% of breast cancer. But if you do 2 to 3 drinks, it causes 20% higher risk for breast cancer. So if you can work on that, cut down your lazy lifestyle, have a healthy lifestyle, healthy weight, and your risk factor goes down with that. Smoking, along with drinking, also puts you at a higher risk. Smoking is bad for any kind of cancer. It's bad for overall health. So if you can take that down, you can decrease your chances of being exposed to breast cancer and other illnesses. Women who have taken birth control for more than 5 years also put them at a higher risk for breast cancer. So ask yourself and go see your healthcare provider to see if they can switch your birth control to something different, so you are not at higher risk. Women who have taken hormone replacement therapy are also at higher risk. So if you are taking those, please bring it to the attention of your healthcare provider so they can examine you and monitor you closely. Some signs and symptoms, very important, that I want you to remember. If there is any change in the shape, size, and form of your breast, you need to go see your healthcare provider. If you see any dimpling, nipple retracted, any protrusion through the nipple, single duct discharge, if you press on your nipple and one duct shoots out the blood, water, or milk, you need to go see a doctor. Or if you're changing your clothes and you see there is a drainage in your bra on your shirt, that also needs attention. If you have found axillary lump on your monthly exam, or if you've seen your breast having dilated, distended veins, not a good sign. You have to see a doctor. Any kind of ulceration and the appearance of an orange skin, which is very shiny with prominent pores, looking oranges, looking inflamed, also requires the attention of doctor ASAP. And how is the breast cancer diagnosed? By your history, how you present yourself to a healthcare provider, and how the other healthcare provider take the history also very important. So make sure that you have good time spent telling them your life history so they can put you in an average risk or in a higher risk. A thorough physical exam also helps to diagnose breast cancer. Self breast exam done at home. Most of the breast cancer are detected at home by women. So if you have done that, because you're going to see a doctor once a year, but you do your exam once a month or maybe often, you can detect that very faster. Go for your mammogram. If mammogram has some changes or they cannot uh, conclude uh, the result, they will ask for sonogram or they will combine MRI with it. So these are some techniques of diagnosing breast cancer. Breast self exam, very important. 3 ways of doing it: by looking, by feeling, and by squeezing. So when you stand in front of the mirror, please make sure you look at your breast, examine them in 3 different positions with hand on your hips, hand on your sides, and hands on the top. Then you jump into the shower, you take some soap and lather up, and then go from your axilla to your collarbone. If there is any lymph node enlargement, they will get tender enlarged, so you can detect that. Then cover the breast area and look for any lump and bump. And then you can squeeze a nipple in the end, look for anything that's abnormal. Once again, any kind of water, any kind of milk, any kind of blood. If you're not breastfeeding or you're not pregnant, those things should not be there for you. I've seen women just doing the breast exam and leaving the looking part and squeezing part out. In order for you to say that you have done breast exam diligently, it has to include all these 3 parts. Guidelines: 40 to 44-year-old women, they can get the breast cancer by choice. It's an option. After you hit 45 to 54, you have to get it done every year. 55, 74, every 2 years. 75, after that, your healthcare provider will let you know if you need to, depending on the quality of life. In my practice, I offer breast cancer screening at age 40. Treatment: you can go get the tumor out, you can get the treatment in terms of radiation, chemo, immunotherapy, hormonal therapy. So it's very individualized. It requires the team of surgical doctor, surgical oncologist, and medical oncologist They'll sit down and let you know what is your individualized treatment plan. Take home tips for you: stay healthy, follow a healthy lifestyle, go for your yearly physical exam, get your routine blood work, get your screening exam like screening mammogram, pap smears, colonoscopy, prostate exams. All those things are important, but for breast cancer awareness, please do your self breast exam, clinical breast exam, and get a mammogram as advised by healthcare provider. If you are at average risk at age 40, that's what I would recommend. If you are at higher risk, depending on what the risk category is all 30 years or 10 years from the time your family members were diagnosed with breast cancer. If you have any questions, please email me at provider at Maya Healthcare Clinic. Once again, stay happy and stay healthy. Have a good one.
TV Sunday, the power of truth.